Health workers in the Eastern Cape are contracting COVID-19 at an alarming rate. Yet these frontline fighters do not see themselves as heroes. They say they are ordinary people doing extraordinary work in extraordinary times. Nadine Theron reports from Nelson Mandela Bay.
Quiet scenes outside Nelson Mandela Bay's biggest hospitals reveal nothing of the crisis health workers are fighting inside.
You know, the difficulties in having to triage patients and, saying who gets to go to ICU and who doesn't get to go to ICU, and seeing a lot of people dying around you is an incredibly traumatic experience.
Doctors Without Borders were called to assist in November. They are now running the basement high care unit at Livingstone Hospital.
You need to be able to manage your workforce in such a way that you can take into account the staff illness, the burnout issues and the extra load. And I think that is one of the biggest challenges.
Dr. Peter Hodkins volunteers as the head of clinical management at the field hospital.
The doctors staffing the field hospital are largely Cuban doctors, very much out of their comfort zone and home, and they've been roped in here and working quite long hours, and they have held the place together.
All the high-flow oxygen beds at Livingstone Hospital, the region's biggest, and the nearby field hospital are occupied.
Call it a resurgence, call it a second wave. I think what nobody is debating is the fact that it's going to happen elsewhere, and is already, here in Nelson Mandela Bay, the threat of system collapse is thankfully receding a little.
Private emergency services say they get up to 160 COVID-19 related calls per day. At the hospitals, they have to wait between 2 and 3 hours before patients can be admitted. They see people die of the virus every day.
Nadine Theron, Nelson Mandela Bay.